In the UK, opioid overdoses remain a significant and preventable cause of death. As mental health nurses, we are increasingly likely to encounter individuals at risk of overdose, whether this is in inpatient settings, the community, or crisis situations. But what if a simple, widely available medication could reverse an overdose within minutes and save a life? In this session, we will explore Naloxone, also known as Narcan, and why understanding its use is an essential skill for modern-day nursing practice. By the end of this session, you should be able to do 3 things. 1. Describe what Naloxone is used for and why it is important. 2. Explain how Naloxone works within the human body. And 3. Recognize the signs of an opioid overdose and feel confident in deciding when Naloxone should be used. So, what is Naloxone? Well, it's a medication known as an opioid antagonist. And no, I don't mean that sort of antagonist. It means it works by reversing the effects of opioids such as heroin, morphine, methadone, and some prescription painkillers. It is used in emergency situations where a person is experiencing an opioid overdose, particularly when their breathing has slowed or even stopped. One of the most important things to understand about Naloxone is that it is safe. If Naloxone is given to someone who has not taken opioids, it will not cause harm. Imagine it like giving sugar to a person who isn't a diabetic when their blood sugars are low. This makes it a critical tool in situations where the cause of unconsciousness is uncertain. Another key point is accessibility. Naloxone is no longer limited to hospitals or paramedics. It is widely available through community drug services and charities as part of a harm reduction approach. This reflects a shift in healthcare, from reacting to emergencies to empowering individuals and communities to prevent avoidable deaths. As nurses, understanding this shift is essential to providing compassionate, non-judgmental care. To understand how Naloxone works, it's helpful to briefly look at what happens during an opioid overdose. But to do that, I like to think of it in a completely different scenario. Imagine this. You're standing outside a nightclub, watching the people come in and out. It's only about 8 o'clock in the evening, so there's no bouncer guarding the door, so anyone can come in. Suddenly, a group of beautiful women ride in on a party bus. They all rush into the club, taking the club past its maximum capacity, but people are still able to come in. Eventually, the bouncer comes on shift and starts limiting the amount of people in the venue, and it stops more coming in. Now, in this scenario, the nightclub is the opioid receptors in your brain. The regular guests are the endorphins that naturally occur in the body, and the beautiful women are the opioids. But naturally, the bouncer is Naloxone. Opioids bind to receptors in the brain that control pain, but also breathing. In high doses, opioids suppress the respiratory system, causing breathing to slow or stop entirely. Naloxone works by rapidly binding to these same receptors, displacing the opioid molecules. This reverses the effect of the opioid, allowing normal breathing to resume. However, it's important to recognize that Naloxone has a shorter duration of action than many opioids. This means the effects can wear off and the person may return to an overdose state. For this reason, Naloxone should always be used alongside calling emergency services. Okay, so we now know what Naloxone is, we know why it matters and how it works, but how do we recognize a person having an opioid overdose? Well, recognizing an overdose quickly is critical. Key signs include slow, shallow, or stopped breathing, unresponsiveness or unconsciousness, blue or purple lips and fingertips, which signal cyanosis, and pinpoint pupils. You may also notice choking, gurgling, and snoring sounds, which can indicate airway obstruction. In practice, these signs may not always present clearly, and situations can be unpredictable, so it's important to ask yourself, if this were a real situation, would I recognise these signs in time? And would I feel confident to act? So let's make sure. Naloxone should be administered when an opioid overdose is suspected, particularly when there are signs of respiratory depression or unconsciousness. It can be given as a nasal spray or by intramuscular injection, depending on the available formulation. After administration, the person should be monitored closely. If there's still no response within a few minutes, additional doses may be required. Crucially though, emergency services must always be contacted. It buys time, but it does not replace medical care. One of the most important messages to remember is this. If you are unsure whether an overdose is opioid related, it is still safer to give naloxone than to do nothing at all. So, here's one I made earlier, or should I say delivered earlier, as I received this along with some training from my local council. I will add a link to the end of this video so that you can find your own council and get yours too. But for now, I will describe what's inside. Inside here, you should have one pre-filled syringe which has 5 doses of naloxone, 2 needles to attach to the end of the syringe, plus an instruction leaflet. And that's it. What you do is you connect the needle to the syringe and insert it into the patient's thigh or upper arm. You will do no harm just by twisting the syringe so you can see the dosage on the side, and you push the plunger down to administer the correct dose while holding the needle stable in the patient's arm. And then you remove the whole thing, making sure not to stick yourself with the needle, which you will then, of course, remove from the syringe and dispose of responsibly. So check out the link at the end of this video. I will also include a link to a short video that will show you exactly how it's done from what I've described. Okay, settle down class, alright. Now we're back, let's consider a case study. Consider this scenario. You're at work, in the community, in a crisis team, and a patient you are looking after is found unresponsive. They are also known to have an opioid misuse problem. Their breathing is slow, their lips appear to be turning blue, and they're not responding to verbal or physical stimuli. Let's take a couple of seconds to think about the following questions. At this point, what are you thinking? Would you consider an opioid overdose? Would you feel confident administering naloxone? Well, in this situation, yes, naloxone would be appropriate. Even if you are uncertain about the cause, the risk of not acting is far greater than the risk of administering naloxone unnecessarily. This highlights the importance of both clinical knowledge and confidence when making decisions. Okay, so in summary, naloxone is a life-saving medication that reverses opioid overdoses. It is safe, widely available, and increasingly available within communities. Recognizing the signs of an overdose and acting quickly can make the difference between life and death. As nurses, this is a responsibility we may all encounter. Understanding naloxone is not just about knowledge, it's also about being prepared to save a life. Thank you for watching.